Listen to this carefully. Right now, at this very moment, millions of people just like you are taking pills that could be quietly damaging their hearts. And here's what makes this absolutely terrifying. These aren't some dangerous street drugs or sketchy supplements. These are regular medications your own doctor probably prescribed. Pills sitting in your bathroom cabinet right now. Doctors and heart surgeons across the country are starting to speak up. They're seeing something in their operating rooms that they can't stay quiet about anymore. When they open up patients for surgery, they're finding hearts that look far worse than they should. Hearts that belong to people who seemed relatively healthy. But the damage is undeniable. Severe inflammation, weakened heart muscle, dangerous rhythm problems appearing out of nowhere. And when these surgeons dig into the medical records, they keep finding the same medications over and over again. The science is finally catching up. Major research from places like Cleveland Clinic and Johns Hopkins is now proving what these doctors have been seeing with their own eyes. Certain everyday medications that millions of older adults take are causing real, measurable heart damage. This isn't about rare side effects that happen once in a blue moon. We're talking about serious risks that affect huge numbers of people. Some of these drugs increase your heart attack risk by over 40%. Others can double or triple your chances of developing deadly heart rhythms. And the scariest part, most people taking them have absolutely no idea. But there's one drug on this list that stands above all the rest. One medication that heart surgeons are now calling the silent killer. The research on this drug is so shocking that some experts think it should come with the strongest warning possible for older adults. A huge study of over 500,000 patients found that this drug was linked to catastrophic heart problems. And here's the kicker, safe alternatives exist, but most people don't know about them. Before I reveal that number one drug, I need to walk you through the complete list so you understand exactly what could be hurting your heart right now. But first, do me a favor. Drop a comment below and tell me your age and where you're watching from. I read every single comment and reply to as many as I can. So go ahead, let me know you're here. Alright, let's dive in. Number 7. Proton pump inhibitors. You've probably heard of Prilosec, Nexium, or Prevacid. These are what doctors call PPIs, and they're some of the most prescribed drugs on the planet. They work by turning down your stomach acid, which helps with heartburn, acid reflux, and ulcers. For short-term use, they're actually great. The problem: millions of people have been taking them for years, even decades, and the heart damage is piling up. A massive study looked at nearly 3 million patients and found something alarming. People taking PPIs had a 16 to 21% higher risk of heart attack. That might not sound like much, but when you realize how many people take these pills every single day, we're talking about hundreds of thousands of extra heart attacks potentially linked to these drugs. Here's what's happening inside your body. PPIs mess with something called nitric oxide in the lining of your blood vessels. Nitric oxide is absolutely crucial for a healthy heart. It keeps your arteries flexible and relaxed. It stops dangerous blood clots. It fights inflammation. When your nitric oxide levels drop, your arteries get stiff. Your blood pressure shoots up. Your risk of life-threatening clots skyrockets. Another study from Stanford found that PPIs doubled the risk of dying from heart problems in patients who already had heart disease. The researchers were so worried by what they found that they told doctors to seriously rethink prescribing these drugs long-term, especially for older folks. Here's the good news: most people can manage their acid reflux without these drugs. Losing weight often makes acid reflux disappear. Eating smaller meals and avoiding food for 3 hours before bed helps tremendously. Raising the head of your bed by 6 inches uses gravity to keep acid where it belongs. And if you still need medication, there are safer options like Pepcid that don't carry the same heart risks. But this is just number 7. The cardiac risks get much more serious from here. Number 6. Certain antibiotics. This one shocks most people. Antibiotics save lives, they're miracle drugs. But certain antibiotics have been proven to cause serious heart problems in older adults. The biggest troublemakers are fluoroquinolones. These include Sapril, Levaquin, and Avelox. A major study of over 7 million patients found something terrifying. Taking fluoroquinolones increased the risk of your main artery developing a dangerous bulge or tear by 66%. This condition often kills people. The elevated risk lasted for about 60 days after taking the antibiotic. But wait, there's more. These antibiotics can also mess with your heart's electrical system, leading to dangerous, irregular heartbeats. In some cases, it triggers a potentially fatal heart rhythm problem. Research showed that the risk of serious heart rhythm issues was significantly higher in patients taking these antibiotics, especially those over 65. The FDA has warned doctors multiple times about fluoroquinolones. They now say these should only be used when absolutely necessary and when safer options won't work. For simple infections like urinary tract infections or sinus infections, older antibiotics like amoxicillin work just as well without the heart risks. If your doctor prescribes one of these antibiotics, it's completely reasonable to ask if there's a safer alternative. The next drug on our list is one that millions take for pain relief, often without realizing the danger. Number 5. NSAIDs. NSAIDs are everywhere. Ibuprofen, naproxen, Celebrex. Brand name. Like Advil, Motrin, and Aleve are in almost every household. These drugs are fantastic at reducing pain and inflammation. For younger people using them occasionally, the risks are low. But for older adults taking them regularly for things like arthritis, the heart consequences can be devastating. A comprehensive analysis of over 350,000 patients found something striking. High-dose NSAID use increased the risk of major heart problems by about 1/3. Celebrex increased heart attack risk by 37%. Ibuprofen increased it by 44%. These aren't small numbers. Here's what's happening. NSAIDs block certain enzymes in your body that produce protective substances for your heart and blood vessels. When you block these, you shift everything toward more blood clots, higher blood pressure, and more inflammation in your arteries. NSAIDs also make your body hold onto salt and water, which raises blood pressure and strains your heart even more. A study from Denmark followed over 1 million patients and found that even short-term NSAID use increased heart risks. The dangers started climbing within the first week. This completely destroyed the myth that brief NSAID use was safe for everyone. The safest approach for older adults with chronic pain is to try alternatives. Tylenol doesn't carry the same heart risks, though it can affect your liver. Topical creams with NSAIDs deliver much less drug to your whole system and seem safer for the heart. Physical therapy, losing weight, and targeted exercises can often reduce the need for pain meds altogether. What comes next is a medication that heart surgeons particularly worry about because so many older adults depend on it. Number 4. Certain diabetes medications. Diabetes already dramatically increases your risk of heart disease. That's why choosing the right diabetes medication is absolutely critical. Not all diabetes drugs treat the heart equally. Some newer medications actually protect your heart. But older drugs, particularly some still widely prescribed today, have been linked to increased heart risk. Sulfonylureas have been under scrutiny for years. Drugs like glybride, gliclazide, and glimepiride fall into this category. They work by forcing your pancreas to pump out more insulin. A major study of over 250,000 diabetic patients found that sulfonylurea use was linked to a 20% increased risk of dying from heart problems compared to using metformin alone. Another study found that glyburide specifically was associated with a significantly higher risk of heart attacks. The problem involves several mechanisms. These drugs can cause dangerously low blood hormones that are hard on the heart. They may also affect important channels in heart muscle cells, potentially making your heart more vulnerable to dangerous rhythms. Some researchers believe they may actually speed up the buildup of plaque in your arteries. Compare this to newer diabetes medications. Drugs like Jardiance and Farxiga have been shown in large trials to actually reduce the risk of heart failure and death from heart disease. GLP-1 drugs like Ozempic and Victoza show similar heart benefits. If you're taking a sulfonylurea for diabetes, this is absolutely worth discussing with your doctor. The goal isn't just to lower your blood sugar numbers. It's to prevent the complications of diabetes, with heart disease being the deadliest. The next medication has been controversial for years, and the heart concerns continue to grow. Number 3. Certain sleep medications. Sleep problems plague older adults. Nearly half of people over 65 struggle to sleep. The temptation to take a sleeping pill is completely understandable, but certain sleep medications have been linked to serious heart consequences that make insomnia look like the minor problem. Z-drugs like Ambien, Sonata, and Lunesta are among the most commonly prescribed sleep aids. A large study of over 30,000 patients taking these medications found something shocking. People taking these sleep drugs had a 4.5 times greater risk of death compared to people who didn't take them. Heart problems were among the leading causes of these deaths. Here's what researchers think is happening. These drugs suppress your breathing, which can worsen sleep apnea. Sleep apnea is a major risk factor for heart disease, high blood pressure, and stroke. By making sleep apnea worse, these medications indirectly increase your heart risk. Additionally, these drugs cause falls and injuries, which are extremely dangerous for older adults with heart disease. Benzodiazepines like Xanax, Ativan, and Valium carry similar concerns. Research found that benzodiazepine use in older adults was associated with increased death from heart causes. Better approaches to insomnia exist. Cognitive behavioral therapy for insomnia has been proven more effective than sleeping pills for long-term sleep improvement. Good sleep habits make enormous difference. Keeping a consistent sleep schedule, avoiding screens before bed, keeping your bedroom cool and dark, and limiting caffeine to early morning all help tremendously. For those who still need occasional help, low-dose melatonin appears much safer than prescription sleep aids. We're getting close to the most dangerous drugs on this list, and the next one might surprise you. Number 2. Certain antipsychotic medications. Antipsychotic medications are sometimes prescribed to older adults for agitation, behavioral problems with dementia, or psychiatric conditions. The use of these drugs in older adults has grown substantially, and heart surgeons are increasingly seeing the consequences. A landmark study of over 44,000 elderly patients taking antipsychotic medications found something deeply concerning. Patients taking these drugs have roughly double the risk of death compared to non-users. The excess deaths were primarily from sudden cardiac causes. These drugs can cause dangerous changes in heart rhythm. They also cause metabolic changes that increase heart disease risk, including weight gain, elevated blood sugar, and bad cholesterol. Some antipsychotics cause sudden drops in blood pressure when standing up, which can lead to falls, fainting, and sudden cardiac events. The FDA has issued the strongest warnings about using antipsychotics in elderly patients with dementia. Despite these warnings, off-label use of these medications remains disturbingly common. Safer approaches exist, identifying and treating underlying causes like pain, infection, or medication. Side effects often resolves behavioral problems without antipsychotics. Environmental changes like reducing noise, maintaining consistent routines, and ensuring adequate lighting can help tremendously. And now we arrive at the number 1 drug on this list, the one that heart surgeons say poses the greatest threat. Number 1. Certain prescription pain medications. Opioid pain medications represent the single greatest pharmaceutical threat to the hearts of older adults. We're talking about oxycodone, hydrocodone, morphine, fentanyl, and tramadol. Brand names include OxyContin, Vicodin, Percocet, and many others. These drugs are tremendously effective at relieving severe pain, but their impact on the hearts of older adults is now undeniable. A massive study of over 575,000 patients over age 65 found that long-term opioid use was associated with a 65% increased risk of dying from heart problems. That number is absolutely staggering. Another study found that starting opioids in older adults more than doubled the risk of heart problems in the first 30 days. Here's what's happening. Opioids slow and weaken your breathing. This leads to lower oxygen in your blood, which stresses your heart tremendously. During sleep, oxygen levels can drop dangerously low. This triggers inflammation and stress that damages blood vessel walls and heart muscle over time. Chronic opioid use causes changes in heart structure and function that look like heart failure. Opioids also disrupt the nervous system that controls your heart rate and blood pressure. Studies show opioid users have reduced heart rate variability, which is a marker of heart health. Low heart rate variability is linked to increased risk of sudden cardiac death. The immune system effects add another layer of risk. Opioids suppress immune function in ways that may promote plaque buildup in arteries. Research shows opioid users have higher levels of inflammatory markers and accelerated plaque accumulation. Perhaps most concerning is how opioids interact with other medications older adults commonly take. Opioids combined with benzodiazepines create a particularly dangerous combination. Both suppress breathing, and together the effect is amplified. The path forward for older adults with chronic pain is challenging but absolutely possible. Pain specialists now emphasize combining multiple non-opioid strategies. Physical therapy addresses underlying mechanical problems. Nerve blocks provide targeted relief without systemic drugs. Cognitive approaches help patients develop skills for managing pain without constant medication. For older adults currently taking opioids, gradual tapering under medical supervision is often possible. Many find their pain actually improves as they reduce doses, because opioids can paradoxically increase pain sensitivity over time. The heart surgeons sounding this alarm aren't telling you to throw away your medication. What they're urging is informed conversation with your healthcare providers about heart risks. Many medications seemed reasonable when prescribed, but now carry known heart risks that weren't fully understood at the time. The research has evolved. Patients deserve to know what that research shows so they can make informed decisions about their own hearts. The heart damage from these medications is often preventable. But prevention requires awareness, conversation, and a willingness to explore safer alternatives when they exist. Now I'm really curious about something. After watching this video, are you planning to talk to your doctor about any medications you're currently taking? Or do you feel like bringing up these concerns might damage your relationship with your healthcare provider? What's holding you back or pushing you forward? This conversation matters more than most people realize. We want to hear from you. Are you or someone you know taking any of these medications? Have you noticed any unexpected heart symptoms since starting them? Share your experiences in the comments below. We love hearing from you. Thanks for watching.